All right. We're at 10:32 and we're just starting off with a few of the welcoming and housekeeping slides. So I'm going to get us started as a few more folks are joining us online here. So good morning, everybody. My name is Vanessa Manuel and I'm the Executive Director here at BC Healthy Communities. And we're really excited to have you all here today to talk about how to make transportation age-friendly within your communities. I'd like to thank our BCHC colleagues here, our BC Health Communities colleagues who are facilitating this webinar in the background, as well as our two speakers today. Laura, next slide, please. Thank you. And so just before we get started, I would really like to take a moment to acknowledge that here with BC Healthy Communities, I am fortunate to work and live on the traditional territories of the Lekwungen peoples, including the Wasanic, Songhees, and Esquimalt First Nations. The ongoing relationships of Indigenous peoples with the land is recognized, emphasizing that these relationships are not only simply historical, but they continue to this day. The first peoples have been here since time immemorial, and their history is long and rich. Next slide, please. So just a little bit here about BC Healthy Communities. We're a team of planners, of public health specialists, and community engagement practitioners that operate at that intersection of planning and public health, as well as parallel to government. Here at BC Healthy Communities, we believe that it is possible, and not just possible, but necessary to create communities where it is easy for citizens to be healthy and well. And today we aim to provide ways that you can strengthen your community by engaging with older adults. We recognize that helping older adults to stay active and independent is an important part of healthy aging. And to do this, we need to make sure that they can get around safely and easily. The goal of this webinar today is to talk about and provide examples of real life solutions to build better transportation that's going to support older adults. So next slide, please. Perfect. And our numbers are continuing to come up here. That's great. And we also have Stephanie posting some links here in the chat as well as I read along. So thanks for that, Stephanie. So just a few housekeeping slides before we get moving along today is that we have two speakers here who will both go through their presentations, and then we will follow this by a question and answer session. So please post any questions that you may have in the Q&A box at the top of your screen. It's kind of right next to your chat feature there as well, or which kind of shows the number of people here in attendance. And so I just also want to let folks know that at the end of the webinar, a survey link will be posted in the chat. And if you could take a few moments to fill out that survey, we would really greatly appreciate it. The feedback from these surveys really helps us to better understand the webinars and what might the communities be looking for in the future. So this just really helps us to know if we're hitting the mark and where we can be going with those future offerings. In this day and age of technology and everything as well, I would kindly ask that if anybody is using any AI recording supporter devices, that you please turn those off. We're just starting to see those more and more pop up in some of our meetings and webinars, and we kindly ask that you do not record the session yourself. We are recording this session, and the webinar will be posted online on the BC Healthy Communities website via YouTube, and it will also be distributed to participants who engaged in the webinar today, as well as those folks who were unable to attend. So you will receive a link at the end of this webinar to the recording, as well as a resource sheet once the webinar has been completed and they are ready to go. I just also want to let folks know too that they are muted and cameras are automatically off. So again, please make use of that Q&A feature within your webinar features here on Teams. So as I was saying, we have two fantastic speakers here who are going to be chatting with us this morning. First up, we have Kate Hosford, who is a population health researcher with intersex and experience in urban aging and healthy cities. She completed her PhD in health sciences at Simon Fraser University with a focus on older adults' mobility and transportation solutions for engaging aging populations. Since completing her PhD, Kate has worked across the transportation and health sectors, first as a policy analyst with the Ministry of Transportation and Transit, and currently she is in a role as a data analyst with the Fraser Health Authority. So welcome to Kate. The second speaker that we have today is Helen Cook. Helen is a full-time resident of Gabriola Island, where she is retired from working as a transportation project manager for TransLink in the Metro Vancouver region. Since retirement, Helen has worked part-time consulting with Watt Consulting Group of Victoria on various transit planning projects until 2025. Helen is also a volunteer board member of the Gabriola Community Bus Foundation, affectionately known as GERTI. So Gabriola's Environmental Responsible Transit Island Express. Helen has been involved with grant writing and oversight on initiatives such as age-friendly planning study, community passenger transportation funding, United Way Aging in Motion grant, and the Rural Transportation Services Fund. Thank you both for joining us and for everybody here on the line today. And with that, I'm going to pass it over to Kate. Thank you.
Great. Thanks for the introduction. I'm really happy to be here. Age-friendly transportation solutions was the focus of my PhD, and in the next 20-25 minutes, I'll be sharing some research and solutions I came across during this time. Next slide. So I'd like to start by acknowledging the ancestral, traditional, and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations, where I'm presenting from today and where much of my research took place during my PhD. In reflecting on the land acknowledgement for today, one thing that came to mind was the respect that many First Nations and Indigenous communities have for elders and their community. Not always, but I think sometimes this respect is less pronounced in Western cultures, and I think it's something that's really important, and keeping respect for older adults and the value they bring to our communities in mind when we design our communities can help translate to built environments that are more age-friendly and benefit older adults, but also populations of all ages. Next slide. In terms of my personal interest in this topic, there are two main drivers that brought me to study this topic. The first reason is based on where I grew up. So the image on the left is the street that I grew up on in Richmond. There's no sidewalks. The closest transit stop was about 1 kilometer away. And even then, the bus would only come once or twice every hour. And so I was really dependent on my parents for getting around my community, for trying to hang out with friends, and so on. And so this was my first insight into how our cities can limit our opportunities to engage and socialize in our community. More recently, I've also seen this at the other end of the spectrum through witnessing my grandparents age and go through the process of giving up their driver's license. It was challenging for kind of all of them. And I think, yeah, it was a real struggle between like my parents and my grandparents and all that. So this is an image of my grandfather in Ontario. When he gave up his driver's license, he wasn't happy about it, but he did right after go out and buy himself a scooter, which didn't allow him to get to grocery stores or anything like that, but at least to the mailbox at the end of the street. And so this is us on one of those trips. Next slide. Beyond my personal interest in the topic, there are broader reasons why we should care. Like many countries around the world, the population is aging, and this trend is expected to continue. The vast majority of older Canadians want to age in place, so that's continue to live in their home for as long as they can. Aging in place is often a more cost-effective solution for our healthcare system as well. In order to support people to do that, we need transport solutions so that people can continue to independently get around their communities. Decades of planning around the car has meant that many older people are left with few alternatives when they either give up their driver's license or mobility limitations prevent them from using public transit. Next slide. One of my favorite things about working in this area is that solutions that address that work towards more age-friendly built environments often address multiple priorities. So there's opportunities to align solutions with climate change efforts as well as Vision Zero initiatives. Transport accounts for about a third of our emissions, and older adults are a really large segment of the population that's either in the market or near market for alternatives. And so targeted solutions to this population can help transition them to more sustainable modes of transportation. At the same time, age-friendly built environment solutions often align really well with Vision Zero principles, which can help reduce the burden of traffic injuries and deaths in our communities. And so I think for those who are planners or people who are applying for grants, keeping these multiple benefits in mind when you're applying can help strengthen the case for your initiatives. Next slide. So my plan for today's talk is to provide a light touch overview of some research and solutions that I came across during my research for each of these modes. So starting with driving, next slide, please. So driving is the most common mode of transportation for older adults and most age groups. Some national data that I analyzed from the Canadian Longitudinal Study on Aging a few years back found that about 90% of older adults have a driver's license. This proportion varies by gender, age, and where you live. So across most age groups, men are more likely to have a driver's license compared to women, and this gap typically increases in older populations. As you might expect, the proportion having a driver's license decreases with age. And then depending where you live, people who live in rural settings tend to have a driver's license and retain it longer. I think I heard from people who lived in rural environments that people often retain their driver's license longer than they ideally should or want to have because there's few alternatives available to them. Next slide, please. So the topic of giving up a driver's license can be a difficult one to broach. This same data set showed that only about 1 in 6 older adults have spoken with a medical professional about their driving safety. It does increase to about a quarter of older adults who are aged 85 plus, but even still, this is quite a small percentage. I think it's a hard topic to bring up because driving in many cases is linked to people's independence, and giving up driving might lead to larger kind of conversations or having to think about where you live and having to move. Next slide, please. So these are some quotes from a Canadian research study that interviewed older adults in rural and small towns in Canada. And I think it just illustrates the different feelings people have when it comes to giving up a driver's license or experiences. So one non-driver said, "I hadn't really thought about it. It took me by complete surprise." Another driver says that they certainly don't want to move. They have no intention of moving. If they weren't able to drive, I don't know what I would do. I don't know. And so I think it's just hard for some people to even contemplate because there's really not many alternatives out there. And then this last quote resonated with me because it's something I often heard from my grandparents in terms of feeling like a burden. So this non-driver said, "I'm totally dependent. I do have a daughter that drives me, a son that drives me, so I'm not lacking drivers. It sounds simple, but it's not. For me, it's very complicated. It asks a lot of very, very busy people because everybody works. It asks a lot of their time. It asks a lot of me." And so this speaks to the burden that both the people providing the rides might feel, as well as the people asking for rides. Yes, thanks. So one resource that I came across was called the Driving Dementia Roadmap. This is a tool that was developed by researchers and healthcare professionals in Toronto, and it's targeted at people with dementia, but it, I think, relates to many older adults who are aging. And it provides resources depending on how you're coming to this website. So there's resources if you're the person experiencing dementia, if you're the person caring for the person, or if you're a healthcare professional and need ideas about the resources that are out there. So yeah, in terms of if you're coming to this as a planner or I think licensing is often outside the scope of what municipalities do, but I think maybe the role for municipalities here is to really think about the alternatives that you're providing in your community. Are there alternatives for people to if they do give up their driver's license, that there's alternatives they can turn to, and then also pointing people to resources like this so they have that information. Next slide. In terms of transit, one thing that municipalities can do to promote age-friendly environments is by providing bus stop amenities. So these are often in the purview of municipalities to own and maintain the bus stop shelters, sidewalks, and certainly crosswalks to bus stops. This image is before and after pictures from a study. The study was actually done in Salt Lake City, where they looked at 30 bus stops that had treatments where they added shelters, sidewalks, signage, etc. And they compared ridership over time to bus stops that didn't have any changes. And they found that the bus stops that had these amenities added did see an increase in ridership, but also interestingly saw a decrease in paratransit demand in the surrounding area. And I thought this was an interesting finding because paratransit, which is more individualized transit service, can be more costly. So kind of from a transit provider perspective, if you just add a little bit to make the bus stop more friendly for people, that this can allow them to take conventional transit for longer and potentially save costs with paratransit. Next slide, please. Another initiative that has had some success is transit training. So these are images actually from Better Environmentally Sound Transportation, a nonprofit that has provided this service through their Seniors on the Move initiative. But transit training is also offered by BC Transit and TransLink in some communities. Typically involves a workshop session where people learn about the transit system and how it works and can ask questions, and is paired with an actual field trip where people go out in the field to test out the transit service, go to a destination, and kind of experience it firsthand. And I think these sessions typically get a lot of positive feedback. Next slide. And lastly, one initiative I wanted to highlight or organization is the York Region Transit System. So you can Google them, and they have quite well developed services for seniors in their jurisdiction. One of the services they offer is mobility on request. And this service is available for all seniors over the age of 65. It's offered, I believe, during weekdays from 7 a.m. to 3 p.m. And people can phone same day for a trip. The trip can only be within a 5-kilometer radius of their starting point. And the cost for it is the same as the public transit service, which is $275. So I think this can really fill the gap in spontaneous trips. Sometimes people just need a ride to the grocery store or to meet up with a friend. And it's just providing that really localized service for seniors. So I recommend checking out their website if you want to learn more. And yeah, next slide. So during my PhD, I focused a lot on community-based transportation. There's many different ways to define it, but I usually defined it as transportation services that are outside of the conventional transportation system, typically provided by nonprofits or municipalities, and often in the form of volunteer driver services or shuttle bus services of some type. Next slide, please. So this research was conducted for the Provincial Working Group on Seniors Transportation, which is a working group in the province hosted by United Way and BEST. The two objectives of this project were to profile successful or promising models of seniors transportation in BC, and to learn what facilitates or impedes the success of these services. Next slide. So I focused on these 6 cases, which included Step Up and Ride Society in Dawson Creek, the Zunga Bus in Powell River, Richmond Cares, Richmond Gives Volunteer Driver Program, the Collingwood Seniors Shuttle, Delta Seniors Bus, and Seniors Go Bus in the North Shore. So the intention was to feature different geographic areas, as well as models that had either successfully operated for a number of years or were promising in some regard. So the Zunga Bus and the Delta Seniors Bus are both municipally led initiatives, and the rest are operated by nonprofits. So I do have a report available that I can share after that summarizes each of these services in detail, but for the purposes of this presentation, I'll just summarize a few high-level takeaways that came out of it. Next slide. Okay, so the first is that multiple sectors and levels of government recognize the gap in seniors transportation services. Yeah, funding for these services is often intermittent and inefficient. And so you'll see lots of grants that become available for community led services. They're sometimes one-time or limited amounts of money. And so it's hard to operate a service continually on these kind of patchwork grants that come up. But I think the positive thing is that different levels of government are recognizing there's a gap clearly, and hopefully some of these funding initiatives can translate to more longer term initiatives. Next slide. Kind of relatedly, the senior serving sector, so that's senior serving community, like nonprofits and things like that. They're highly knowledgeable about older adults' transportation needs, but they really lack ongoing funding, and it's a barrier to delivering effective services. So this is a diagram that I drew up after several interviews with different community transportation providers. And they kind of, especially those in the nonprofit sector, highlighted a pretty similar pattern. So typically it starts with identifying a need for seniors transportation. Because there's a need, they're often successful in obtaining funding through a grant. And then they're able to deliver a service that works reasonably well because it's designed around their needs. But kind of to the point earlier, it's difficult to obtain funding for ongoing costs. Typically, it's easier to get the startup costs funded. And so some of the community organizations had to reduce their service, which made it a less useful service. So ridership decreased, and then it made it more difficult to obtain grants. And then there was this kind of downward spiral. So I think, again, ongoing support, particularly operating funding, seems to be a real gap in this area. Next. Something about the success of these services that I think can go overlooked, but is really important, is the role of the driver. So the role demands someone who's not only a skilled driver, but is also empathetic, has an empathetic and caring demeanor. So despite the importance, finding and retaining drivers was something that most nonprofits spoke to as particularly challenging. I think in the case of the Delta Seniors Bus, they had a municipal pool of drivers, and they didn't speak to the challenges as much. So maybe having this municipal pool of drivers in some cases can be an advantage. Next slide, please. And then lastly, one of my favorite takeaways from this project was that transportation services that work well for seniors can also benefit a wide range of population groups. So the only service that I looked at that served all population groups was the Zunga Bus. This is an on-demand transit service in Powell River. And I loved the interview. They I think they did interviews with people who use this service, and some of the quotes from this really highlighted how it not only served older adults, but many different population groups. So for an older adult with mobility limitation, they mentioned they don't know how they get around without it. So handy, so convenient. I don't drive and have trouble walking. I use it to meet friends for coffee, regular things. I'd for sure like the Zunga bus to stay. I'd be stuck at home otherwise. And so I think the on-demand nature of this just allows someone to get out for those more spontaneous trips or smaller things like just grabbing coffee. It also benefited people with disabilities who had lost the ability to drive, parents who didn't have a car, and then youth traveling to summer jobs. So someone mentioned that they used it to get to their summer job back and forth every day. They can't get their parents to always drive them. And so I think in this case, the Zunga bus was helping that youth, but also the parents, in that they didn't have to shuttle them back and forth. All right, next slide. So lastly, in active transportation, wanted to start off by highlighting that older adults are one of the population groups that disproportionately experience higher rates of pedestrian injuries and fatalities. This data, which is a little outdated now, but the trends are the same, shows that in particular in that 85 plus group, there's a much higher rate of transport-related hospitalizations related to pedestrian injuries. There are things we can do. So next slide, please. One of the most effective things is reducing speed limits, because speed leads to greater injury, risk of injury and fatality for pedestrians. And kind of many municipalities are trialing this out. In Edmonton, I believe they reduced their speed limit from 50 to 40 kilometers per hour, and they've seen noticeable effects from this. So they had speed cameras at a number of different locations, and at least 50% of the locations, they saw that speed had reduced as a result of these limits. And they also saw about a 30% decrease in injuries and fatalities across the city, which is quite substantial. Secondly, advanced walk signals. So this is where the walk signal changes before the green light. And so that gives a chance for the pedestrian to get a little bit into the intersection before the cars are moving, giving them greater visibility. So in the city of Vancouver, they've implemented several of these and haven't seen any stats from them in terms of injuries and collisions yet. But I guess from my perspective as a pedestrian, I do feel a lot more comfortable and visible getting that head start and knowing that I'm kind of in the crosswalk sooner. And I think in particular for older adults who can sometimes be a bit slower to get moving, it just gives them that extra time so that they're seen in the crosswalk before the light changes. Next slide. And then lastly, I wanted to highlight e-bikes. So you've probably seen e-bikes increase in popularity quite a bit in the last 5 years or so. For older adults in particular, they're known to extend the distance that people cycle, as well as the years that they're cycling. So these are a couple of quotes from a study that interviewed older adults on their perspectives of e-bikes in Waterloo. And they found, one mentioned that they use their pedal bike for short trips, but for going to the store, they take their e-bike because there's hills and it's a long way. And so I think the e-bike allowed them to take that trip with a sustainable mode as opposed to using the car. And then in the second quote, they talk about how instead of kind of losing their social group for riding, they opted to get an e-bike, and that allowed them to continue in that group for longer. In terms of facilitators for e-bike use, two of the most common things that come up are wanting safe infrastructure for riding, as well as secure bike parking. And so I think these are two things that municipalities can really focus on to promote the use of e-bikes. In terms of bike parking in Vancouver, and I know in Victoria, there's been more bike valets in recent years in the summer. And as an e-bike owner myself, I find these really great for having an e-bike and feeling comfortable and leaving my bike for kind of several hours on end. Next slide. So to close, I wanted to highlight a few funding opportunities, which you might be aware of already. But to briefly cover, federally, there's the Rural Transit Solutions Fund, and this is targeted at communities who are less than 50,000, as well as the Active Transportation Fund, which is for communities of all sizes. These two are part of the Canada Public Transit Fund. I don't believe they're open right now, but I find that application windows typically come up on pretty short notice, and you only have like six to 8 weeks to apply. And so I think just looking at the criteria in advance and having an idea of a project before it opens can be useful, so you're ready to go when that window opens. There's also the New Horizons for Seniors program, which I think many senior organizations take advantage of. Provincially, one that I think is lesser known is the Transit Minor Betterments Program, and this is in the Ministry of Transportation and Transit. So they provide up to $100K for transit supportive projects. And so this could be like upgrading bus shelters or providing sidewalks to get to the bus stop, things like that. What's nice about this one is its applications are accepted on a rolling intake. So if you have any questions about that, I'm happy to connect you with the people who manage this program. And then there's the BC Vision Zero and Road Safety Grant Program, as well as United Way BC Aging in Motion Grant. Next slide. So just to conclude, I think momentum for action on seniors transportation is growing. We see this in the number of grants that are coming out and the number of webinars and age-friendly transportation planners that are being hired within municipalities. I think there's many opportunities to align solutions to address multiple priorities, and multiple solutions are needed. There's not just one that's going to make the fix, and I think they can target different aspects, like providing, like easing the transition from driving to alternatives, improving the transportation options that are out there once you give up your driver's license, as well as providing subsidies for older adults where needed so they can afford different transportation options. So thanks for listening, and I'll pass it back over to Vanessa.
Perfect. Thanks so much, Kate. That was wonderful, and what an informative presentation. And thank you for sharing your research and experience with us. And I agree, it really does take a very strategic, collaborative approach. There's not just one solution, but multiple ways that we should and can be supporting our older populations, as well as other populations with transit and travel in a safe and accessible way. So thank you very much. Helen, I would like to offer the presentation now over to yourself to take us through your grant program that was supported with the 2024 Age-Friendly Transit Consultation. So thank you very much.
Thank you, Vanessa. Good morning, everyone. And yes, I'm very happy to be presenting to you this age-friendly consultation program that we conducted over the summer of last year. This front side shows you a little artist in rendition of our current bus that we have in service here. Gabriola is known as the Isle of the Arts, and so hence it's appropriate that I could use this image. And I want to say at the start that I think this case study is a great example of many of the observations from Kate's presentation, especially in regards to the needs, the types of services that are important for seniors, and the whole funding situation. I think she captured that very well. We've experienced many of those observations ourselves. So for today, I think my agenda is going to provide you a bit of context about what's happening here on Gabriola as far as transit goes, a little bit about our project description-wise, and some of our consultation results and what we're doing with those results. Next slide, please. So as an acknowledgement, we are the ancestral, traditional, and unceded territory of the Snuneymuxw First Nation. This First Nation is resident here in Nanaimo. It doesn't have residency here on Gabriola at the moment, but I would just like to share that acknowledgement with you. Next slide, please. So Gabriola sits off the coast of the Vancouver Island, very close to Nanaimo. It's a 20-minute ferry ride to Nanaimo. These census statistics for Gabriola were compiled by the Health and Wellness Collaborative, which we have here operating on the island. It's home to about 4,500 residents. 49% are of working age and 44% are retirement age. I like to think that the society here, the demographics here are very much like society in general, but it's a rural environment. Our median age is older than the provincial average, and our after-tax income is a little lower as well. I think a reflection of the number of retirees who are living on this island currently. There is a taxi service here. There are taxi savers. There's a volunteer driver to doctors program. And these are all funded either from property taxes or grants and aids programs. Next slide, please. So just a little bit of history about our bus service. This service was initiated in 2013, and at the time, for about 2 years, it was run entirely by volunteers. I wasn't involved in that. A lot of really energetic older adults and some retirees got together and did some fundraising, bought a couple of buses, and ran this with volunteer drivers and donations for a couple of years. It proved very popular and successful, and in February 2016, we held a referendum vote to approve property taxes to be provided for the service, and that has been ongoing since 2016. It was a very successful campaign, let's put it that way. Their volunteers are very much still involved. I am one of them. Our Gabriola Community Bus Foundation is managed by a group of volunteers. All the administrative functions, except for bookkeeping, are done by volunteers. So all the marketing and public campaign and things like that. We pay our drivers. We have 6 to 8 part-time drivers, and we have a part-time coordinator. We pay for mechanical services and bus cleaning and that sort of thing by contract. Next slide, please. So our service operates 6 days a week, and our schedule here is on the right-hand side. It operates as a flag-down service mostly. There are a few bus stops in the system where you can wait, and the driver will pick you up there. One of them is the ferry that goes to Nanaimo. We pick people up and drop people off there regularly. We have bus stops in the village, one of the other commercial sites, and a couple important places along the main loop road where there are several subdivisions that come out. Our service, as you can see, is color-coded. It's our attempt to help people understand where the bus will be and when it will be there. Each color denotes a particular location on the island, and then the times that it'll be there are corresponding. We do ask people to pay a cash fare or use a ticket, or a day pass or a monthly pass. So we have all those systems in place, and all of that is administered by volunteers. Next slide, please. So in terms of ridership, we've had good years and bad years. Gertie ridership has been certainly growing consistently over the last 10 years, but it was significantly affected by the COVID-19 pandemic. Ridership hasn't really recovered to the pre-pandemic levels as yet, and we're doing a lot of work to try and figure out how we can improve the service and attract more people to come back to using the bus. We have a number of different types of riders, and I'll talk to you a little bit about that if you want to show the next slide, please. We have mostly adults using our service right now. When the service schedules were set up, we have runs in the morning, runs in the midday, and runs in the late afternoon, early evening. So we definitely seem to be capturing some of the commuter market, people going to and from the ferry or different jobs on the island. Seniors are the second largest group, and cash and prepaid are the most common form of payment here. In fact, cash is basically the most common form, but we do offer tickets at a discount, and some people do use those. Next slide, please. So we, as I say, we like to have little celebrations here. And this year, or sorry, last year in the spring, we welcomed our 200th passenger overall. We do count our passengers and we classify them by their fare payment and by the age, not with asking them, but just by sort of eyeballing it. Our drivers are great at ticking little boxes on a sheet so that we can keep track of how many people we have on the bus and when by run, etc. Next slide, please. So I'm going to talk to you a little bit about our project here on the island. We worked with the RDN to apply for this grant. So the service here is actually operated by the Gabriola Bus Foundation. We're a nonprofit society. We heard about the opportunity for this grant, and so we approached the RDN staff and Transportation Division to help us apply for the grant, and they were very supportive of that. Our area director here, which sits on the RDN board, is Vanessa, and she's always been a supporter of the service, and she is now actually the chair of the RDN board. So it's great to have their support in applying for the grant and administering the funding for us. So the project was essentially to do community consultation and try to engage the seniors population to tell us what it would take to create a transit system that would more effectively meet their needs. We received a $15,000 grant from BC Healthy Communities Age Friendly Program, and we thank them very much for that. This could not have happened without the funding for sure. And our aim here was to review the transit service that we're currently offering and ask what we could do to improve it for our aging population, because we clearly don't have that many seniors on the bus. We have mostly adults and youth. Next slide. So we structured this engagement using a local consultant with nonprofits experience and community engagement experience. We set up the consultation in 2 rounds. We did an online survey. We hosted various community groups or went to their regular meetings and held meetings, focus group meetings with them. We attended a few markets. There's a regular market here every Saturday and Sunday during the summer, and we attended a couple of those with our iPad survey forms and asked people to fill in their surveys. We canvassed nonprofit and business leaders, and we distributed all the links we could to the online surveys in different locations, and we wrote articles in our local paper and posted advertising and did multiple Facebook posts, all to encourage people to respond to our survey and give us their ideas for the service. Next slide, please. So what I thought was a very intense effort to get people engaged resulted in a survey online by May and June, and we had about just a little over 200 respondents. About 73 were riders and non-riders were 140, which is great. We asked them in the first round about things like car ownership. Did they use the bus? Were they a people mover? Did they give people rides, or were they getting rides from other people? We asked people about their perceptions of Gertie, the bus, whether they felt it was on time or clean or friendly, that convenient, that sort of thing. We asked them about their desired destinations by neighborhood and other locations on the island, like parks and the village center and the library, that sort of thing. We asked them about schedule. We were very curious to know whether people understood the schedule, whether they used it, and how they used it. And then we asked them about just the general value of Gertie to the island, just whether they felt it was an important service or not here on the island, and how much they supported the service. Next slide, please. So some of the questions, as I mentioned, they were intended to inform us about Gertie in general and how the public perceived the service in terms of its ridership. We were hoping to see whether there were any differences between riders and non-riders. And a non-rider is basically someone who said they never used the bus. What we found was that most people were aware of Gertie, but that many of the non-riders were, of course, not well informed about its services. But we did find a high level of general support for Gertie, even among the non-riders. We were looking for bias, whether people felt like the bus was, just for poor people or just for people who didn't have a car and that sort of thing. And we actually did not find that so much among the non-riders, and not even among the people who do ride the bus. They did agree that Gertie is for people that don't have cars, but they didn't necessarily agree that it was only people with cars. Next slide, please. So since we already know that the majority of our ridership is not seniors, we asked non-riders, most of whom are seniors, what aspect of Gertie's service would be most important to them in order to use the bus more often. What this graph is showing that you can see that having an easy walk to the bus stop is very important, maybe more than any other attribute. This is because possibly our routing stays for the most part on the main roads. It's a rural area. People do have longer walks out sometimes to main roads, and these roads are not always in the best shape. They're a little bit hilly. There's lots of potholes, that sort of thing. And we don't really have the option of rerouting the bus because of the way the subdivision is designed. It's kind of like a lollipop situation where the roads are not connected. So we don't have really an option to go into too many neighborhoods without backtracking. So it's important because, of course, many seniors tend to be a little bit less active. Many of the roads have hills. The walks tend to be a bit longer. So we heard this message pretty loud and clear. Next slide, please. So in our second round of consultation, once we had sort of digested some of the community responses to the round one survey and the focus groups we held, during the next round of surveys and consultation with different groups, or the same groups that we had spoken to the first time, we asked a little bit more about their service preferences and what their likelihood of using certain kinds of service might be, whether they'd be interested or willing to contribute funding to certain initiatives that we have underway, or other interests in volunteering, as ideas were presented to us in the first round for that. We talked about schedule improvements, asking whether they would support different ways we could improve the schedule design and distribution. And we asked them about how they found out about Gertie services in the first place and which marketing channels they felt would work best for them. Next slide, please. So one of the things that we tested was of the idea of adding extra service on Monday and Friday. Inflation pressures post-COVID resulted in us reducing our service hours a little bit, and our ridership analysis showed that midday Monday, Friday had the least number of passengers. So we had cut back on that last year. And even though not many people were using that service, many people had requested through the surveys and our focus groups to have that service reinstated. So we asked them again, would you support this? And we did get the majority of people responding that yes, they did want this service to come back. Next slide, please. So the other idea that we asked about in the second round of consultation was the idea of a shopper bus. Some people had presented that as an idea during the first round, and we thought, well, let's just test this out. As it turns out, there really wasn't a lot of support for it. It was kind of like, well, definitely, maybe, would, it was not something that people really jumped out at as saying, yes, I'm going to do this. We did a little bit of corresponding focus group questions with some of the local business owners around this, and they weren't all that keen on it either. I don't think there was an initiative in place for them to coordinate any special day of the week among themselves for seniors shopping, for example. Seniors have a lot of time on their hands, and it's important to note that because they can shop basically whenever they want. So they have a lot of flexibility, and they didn't seem to value the idea that a shopper bus would work for them. Next slide, please. So what we did find out overall is that the barriers to using the schedule or to using the service is the limited schedule, that it doesn't run as frequently as a lot of people would like it to run. It also presents mobility challenges in the sense that the routes, the the mobility challenges relate to where the routes are. People don't want to walk out to the bus where it comes. And our schedules are such that we can't really do, door-to-door kind of drop-off situations. They find that the service is just too far from their home. Complicated routes. When I say that, I think what people were telling us there is that they didn't understand the schedule design, the way it's printed. They understood that the routes have to be designed the way they are, but they had a few suggestions for improving how it's printed, how easy it is to understand the way it's printed. And they also had suggestions about how to target the service to different special events that happen here on the island. So we tested the shopping runs, and well, even though they said they would support that, we didn't think that they would actually use it. It's kind of more of a marketing thing. One of the things that I think we as an organization came to realize through this survey and the consultation is that there are a lot of social benefits to the service that we are offering here. The drivers in particular told us that they have a really strong connection to a lot of the passengers, and we often hear about specific events that have happened in people's lives because they're taking the bus regularly, and people check on each other if they're sick or if they're ill or if they need specific things. It comes to us through the bus drivers sometimes. So there's quite a bit of community building that happens on the bus. Overall, I think people on the island see it as a big benefit, and they do support the service for a variety of reasons. We do have a lot of regular riders, and there are a lot of social connections that are made on the bus. Next slide, please. So we had a lot of this community consultation, the survey, brought out a lot of ideas and suggestions from the bus drivers and from all of the various people who provided comments to us. It was a lot to absorb for our organization, and so what we did is a lot of the ideas were sort of prescriptive, saying if I were to use the bus, it would need to do this. And a lot of the ideas did have a merit. It's just that we needed some kind of framework. So we put them into kind of a framework based on how we as an organization felt we could respond to them. Did we have the budget capacity and that kind of thing. So we classified them into changes to the service, some aspect of the service that were within the current budget, changes that required additional budget or additional service hours, changes that required volunteer or some other sort of paid support, and then just other changes that required additional resources that were unrelated to service hours. Next slide, please. And out of that, we developed a few recommendations. Within the current budget, we agreed that we could adjust the school schedule. There were some requests to adjust that schedule to better meet the opening and closing times of the elementary school. We could advertise a shopping schedule, and we could add some better decals to the bus and to bus stops so that Gertie was easier to recognize. Changes that we see as requiring additional budget include this year-round midday service on Monday and Friday when we had to cut the service. And another thing that we could do but would require additional budget is to do more in the way of event-related schedules. So we have a number of sort of big community events on the island, concerts and beach events and that sort of thing that Gertie doesn't actually have special service for. Things that we would require volunteer support and potentially additional budget include a bus buddy program. This came out as part of the consultation that people don't really know how to use the bus, haven't ever used a bus. And so we came up with this idea that we could maybe develop a bus buddy program where a member of the community could escort a person to use the bus for the first time. And we also realized in order to implement a lot of these services, we need to recruit more board members and project-based volunteers to help us implement some of these things. Some of the things that we would need additional resources for include, an updated rider's guide. Some people thought we should have some more of a colorblind palette. that we should include more tourist attractions and information on the map. We could definitely do more if we had expanded marketing, either local ads, and many people suggested we should do more off-island promotion through Nanaimo Tourism or Nanaimo Chamber of Commerce and that sort of thing. Next slide, please. Just quickly tell you a little bit about our implementation plans as I wrap this up, because we were, because of the data we were provided evidence to us to do other grant applications. We did apply for what do they call it? Aging in Motion grant through the United Way, and we were successful with that. We received notification of that earlier this spring. So we will be implementing the Monday and Friday midday service for at least 1 year as a trial. We've received sufficient funding to do that. That funding will also support us in putting together a bus buddy program and doing a lot more intensive advertising in general and specifically with some of the seniors activity groups that exist here on the island and in different organizations. We are working towards this new service start in July. So we're very fortunate to have received that grant in order to enable that. So we're in the process of setting it up. I guess that's pretty much the conclusion of what I have to say today. I'm happy to entertain any questions or thoughts people may have. Thank you.
Thank you so much, Helen. That's great. We love hearing about community-based projects and engagement, the learnings, how you may apply this, and again, especially connecting back to our age-friendly grants. That's wonderful to share. So thank you. We did have a couple of questions here that I was recording. So again, there's a few things in the chat, and Kate, you were able to address a few of them throughout. And then a couple here for Helen as well. I'm mindful that we've just got a couple more minutes left. So if we don't get to everything today, happy if folks want to email us in any follow-up questions to bchc@bchealthycommunities.ca, and we can connect back with our presenters and try to facilitate those for you as well. So, okay, the first question that I had noted down, and Kate, you did send a link, but Kate, could you please mention the source of the longitudinal data that you analyzed? It had great insights.
Yeah, so this is called the Canadian Longitudinal Study on Aging. It's a study that's been going on for, I think, over 10 years now and following a cohort of older adults. And if you're part of a university, you can access this data set.
Great, thanks, Kate. We did have a comment in here about the transit strike in the Cowichan Valley and just recognizing the impacts that it's having on psychosocial health for our older population. So unfortunately, I don't think that this is something that we can speak to, but recognizing the challenges that that would pose in the community, as that strike has been ongoing for about 4 months now between the union and the employer. So another question that we had in here was, again, during your presentation, Kate, do you know if BC communities have a CAN Drive program like the University of Victoria has? So what it does is take older adults on optional road tests without penalty to see what they need to do to be able to continue their driving on the road safer, and it helps give them some agency and autonomy to inform them whether they may or may not consider giving up their driver's license. So I'm not sure if you can speak to that or not, but
I hadn't heard of that, but that seems like a great program, and hopefully is available in other communities. And yeah, I'll have to look a little bit more into that one.
Perfect. Thanks, Kate. Great. Perfect. And yeah, opportunities we will, yeah, thank you for social prescribing there for that follow-up comment. Yeah, advocate. Helen, there was another question in here too. Is it possible to know what the budget is to operate Gertie, if that is something you are able to speak to or not? And if not, that is okay as well.
Yeah, sure. Well, our current budget is around $208,000 a year. That covers our driver wages, fuel, maintenance, a coordinator.
Perfect. Thanks, Helen. There was also a comment in here as well, and I just any suggestions that may support more rural areas, so less people equals longer distances. Any thoughts, comments, questions at all from our presenters about that?
I can just say a couple quick things. I think in rural settings, it typically requires subsidy, and I think if we want transportation to be available in rural settings, we have to kind of come to terms that there'll be some level of subsidy needed. And then other things I've seen communities do is like share a bus for like having a bus for seniors transportation, but it also serves school pickups. We're getting creative like that. And so I think, and then the last thing I would say is with the rural transportation solutions that the Canada Public Transit Fund has, you can see all the projects that have been funded. So it might be interesting to go and look and see what projects have been funded and follow up with ones that seem relevant to your community and learn from their experience.
Thanks, Kate. Anything else to add there at all, Helen?
Well, I guess I mean, we are a rural area, and you know, our bus puts on an awful lot of kilometers on some pretty rough roads, and I guess I don't really have a suggestion in terms of, you know, how to structure the service. I think we've looked at it and tried to connect the little subdivisions and areas of population on our island as best we can, and bring them to areas, you know, like the village and the ferry, places they want to go. Fortunately, those are concentrated in a little village area, so that works for us. We are also, I should mention, recipients of that rural transportation funding. We don't have our new vehicles yet, but we applied for a capital grant and we were awarded that. We're just waiting for the buses to arrive. But I do believe that funding is available for people to conduct planning exercises as well for rural areas. And I don't know if the window is open right now or not, but I know it was at one point. So I encourage anyone that is interested to apply. They were very nice to work with.
Great. Thank you so much, Helen. And we are about 4 minutes over here now. So I just want to take a moment to quickly plug as well that BC Healthy Communities currently has our Plan H grant programs open. Those are open to local, municipal, and Indigenous communities to apply on until July 7th. So that supports our community connectedness grants to a support of about $5,000 there, as well as our health promoting public policy grants. You can also check out our website, bchealthycommunities.ca, to learn more about previous AFC grants that have been awarded in the announcements that have been posted on our website, previous news links, also to sign up for our e-newsletter to stay informed, where we share resources, opportunities, other grants, things that our partner organizations support, as well as communicate what's going on within our organization to our members. And so with that, I want to take a moment again, as echoed by the chat. Thank you very, very much, Kate and Helen, for your presentations today. We really appreciate you both sharing your hard work and information and learnings and those opportunities with communities here across the province and supporting our older adults population. So thank you so much. And we will follow up with some links, the recording to the website, as well as some of those additional resources. So thank you, everybody, for joining us today. Oh, and one last thing. Thank you, Gurmeet, for reminding me. There is going to be a survey here that Stephanie just sent in the chat, and we will also send that out via email as well in our follow-up. So if you could please help to fill out that survey link, it will just take you a few minutes. It just really helps us to understand how we can best support our communities here. So thank you.
Thank you, Vanessa, for the opportunity.